Hi, Mom. Yeah, no, can you pick up Chris after school? Yeah, I'm at the doctor's.
Mrs. Harris?
Describe your symptoms.
Hang on. Stress, headaches, nausea. Yeah, well, I work on Saturdays.
And how long has this been?
Equanimity. Balance your lifestyle.
Good morning. Who am I speaking with?
This is Cece Donahue.
And Dr. Michael Levine.
I want to thank you for joining us live here in Dallas, Texas on the Valder Beebe Show.
Well, thanks for having us.
Good morning.
Dr. Levine, I'll start with you. You want to talk about hormone disorders, if I'm correct?
Well, what we'd like to talk about this morning is a particular hormone disorder called hypoparathyroidism. And this is a condition characterized by an inability of the body to regulate levels of blood calcium because of a deficiency of the hormone parathyroid hormone. And most patients who have hypoparathyroidism have it as a result of thyroid or head and neck surgery. And during this surgery, there has been some damage or inadvertent removal of the parathyroid glands. And there are 4 parathyroid glands in the neck. And what the study that we're talking about this morning pointed out was that the symptoms and signs experienced by patients with hypoparathyroidism are far more diverse than we had previously thought. Up to now, we thought patients would complain principally of some tingling in their fingertips or toes, maybe around their mouth, some muscle cramping, but now we recognize that there are many, many more symptoms, including something called brain fog, which reduces the ability of people to think clearly and accounts for reduced productivity in the workplace. So this is a very important study because it extends and broadens the range of symptoms that we now recognize as being due to a low blood calcium level.
Okay, Dr. Levine, I want to ask you just one question before I talk with Cece. Okay, is this when you have thyroid cancer or when you take the radioactive pill to have the thyroid go non-active? Or tell me, what is this from?
So that's a great question, and it really turns out to be something I like to call surgical misadventure. A patient is having the thyroid removed. Sometimes it's for cancer, sometimes it's for a very large goiter, and during the procedure, the parathyroid glands are damaged or removed. The parathyroid glands are remarkably resistant to radiation. So radioactivity is used for treatment of different thyroid disorders, doesn't seem to bother the parathyroids or cause this condition. There's really a physical damage in most cases. Some patients will have genetic disorders that cause hypoparathyroidism, but in the United States, nearly 80% of patients with hypoparathyroidism will have a history of thyroid surgery.
You're very thorough in your explanation and very interesting to talk to about this. But I wanted to ask Cece a question. Cece, obviously you're a patient of this, correct?
Yes, I am.
How are you living with this condition, and what makes you be able to function?
Well, it's not easy. My life changed in March of 2005 very drastically after thyroid surgery. So I'm living with it by coping with it and trying to be proactive. I have to manage my serum calcium level every day, which means I have to take calcium all day long, pretty much every 3 hours, and I can take up to 14, 15, 16, even 25 pills a day in order to manage my serum calcium level. And in order to ward off all of those symptoms that Dr. Levine had talked about, that can range from the very benign of the numbness and tingling in your hands and feet and face to much more severe symptoms, which would be severe bone pain, muscle cramping, tetany, when I'm really bad, I can get these laryngospasms that sort of close my throat, which makes it difficult to swallow my pills. And when that happens, that's what we call a calcium crash. So all day long, every hour of every day, I have to manage my calcium so that I don't tumble into a crash.
That's the medication side. How do you deal with this on what I would like to say, a soul side, a spirit side? How do you deal with it on that side?
Well, I do have a very strong spiritual side, and I talk to God a lot about this and ask him to get me through. But I also depend on my family. I have a remarkable family and a remarkable husband. When I was really sick in those early years, for 2 years, he actually left his job to come home and help me take care of, we have 5 children, so take care of the kids. And, you know, with a strong support system like that, it's a little bit easier. But I also stay informed. It's really important when you have a rare disease or a rare anything that you stay informed because, you know, the public doesn't know about it. So it is hard to get support from people that don't understand it. So I aligned myself with the Hypoparathyroidism Association about 7 years into my illness, and that's been a gold mine because after 7 years, I finally met more hypopara patients, and that has been huge. Just the support of people that have the same disease that I have and the same experiences that I have.
CC, by you talking about this, I know you know the power of this, and I want to thank you so very much for sharing your personal struggle on your life's journey. You probably will change more lives than you will ever have the opportunity to know, so thank you so much.
Oh, thank you very much for having me.
Dr. Levine, I want to wrap up. I could talk to you all day about this. This is so interesting. I hadn't heard this. But because there are so many women that I see in the media, because I talk to a lot of celebrities who are having thyroid cancer and having thyroid surgery. I never knew this also was out there. So wrap us up, and where can people go find more information?
So I should point out that this condition, hypoparathyroidism, occurs in less than 1% of patients who undergo thyroid surgery, but you can get a lot of great information from a website, hypoparathyroidism.com.
Dr. Michael Levine and CC Donahue, I want to thank you so very much for making my audience aware, and I want to thank you so very much for what you are doing.
Thank you. Thank you.